So thank you very much, Megan. So welcome everybody to this question and answer session again today. We've got various people from the quality assurance team. We've got quality improvement nurses. I'm not sure if we've got anybody from public health. I can't see at the moment.
Not yet, I don't think.
Not yet. Hopefully they might be able to join us, but we'll keep an eye on that. As always, we'll endeavour to answer your questions as we go through the agenda. If there's something that we're unable to answer, we'll obviously take that question away and signpost to the relevant person to answer. Some of the questions may be public health related, and we'll take them back to public health for them to answer. So thank you everybody for joining us, and I hope you know that this is the meeting that's going to be talking about the infection control and guidance updates. So it's very much around sort of operational and clinical guidance that might have come out, and general guidance basically. So we put an agenda together today just to cover the various items that we've had emails about or concerns about, or just to get updates from as well. So the first one, sorry, just before I start as well, if anybody wants to ask a question, please raise your hand. I'm sure most of you know where the hand button is, and I suppose it depends on your device. A lot of them have them on that top grey bar next to the speech bubble and the three dots. So there's a hand sign there. You can raise your hand, or you can take yourself off mute and just wave at me and say you'd like to talk. Absolutely fine. Or failing that, and you can't come in and talk, or you can't use the mute button, please put something in the chat box so that we can pick any questions up as we go through. So the first agenda item I'm going to talk about is the booster vaccinations and the flu vaccinations, and also the first and second vaccinations. And make sure that, sorry, I'm just squinting here. Let me just make sure that's not covered elsewhere. Yeah. Okay. So obviously, the vaccination programme is still being rolled out, and for all social health and social care staff, we'll be talking about the guidance that's coming in around that in the future. That's item 3. But in terms of your own staff accessing first, second vaccinations generally, and the booster vaccination and flu vaccination, I just wanted to check with people, have any of you got any issues in terms of access of any of those vaccinations, or hesitancy with take up? And that includes flu and booster vaccinations. So is anybody willing to come in and just answer that question? Have any of you got any particular issues with first and second vaccination in staff, booster or flu?
Trina, you're typing. Did you want to come in?
Yeah, we've had no problems whatsoever. The staff have been very proactive, and they've had all their first and second and boosters and flu jabs, and as a company we've paid them for their time and trouble of going and getting them done, so it's a bit of an incentive for them to do it as well.
Thank you, Trina. Thank you very much. And I presume that's through the workforce recruitment and retention, the infection prevention control grant.
Yes, we've used the grant to pay the staff.
Yeah, brilliant. Thank you, Trina. Emily, you've just put just the flu jabs. One member of staff refused the flu vaccine, so it's just the one. So did they say, Emily, why?
First of all, she said, "Oh, I don't want to take it from somebody that might need it more than me." which is
oh, that's very altruistic of her.
Yeah, and I then explained that there's plenty to go around. There's not a shortage or anything. And then she then said, "Sorry, no, this isn't for me." So I respected that because I can't exactly force her to do it. So I then told her the risks, and I said, I'm aware that you've got like vulnerable family members, so just over Christmas, just have in mind, just to protect yourself from them. Hoping that would be enough to do it, but he didn't, and she refused.
Oh, well,
yeah.
I don't know whether it's helpful at all, Emily, but there's quite a few resources, and I know Gemma and Cheryl are on the call today, that have been doing a little bit of promotion. Well, not a little bit, they're regularly promoting the flu vaccination. I didn't know, Cheryl or Gemma, if you just wanted to come in and sort of highlight some of the resources that might be available. I recognise, Emily, that sometimes even giving people information is not going to change their mind, but there are some really useful sort of posters and leaflets and information, just maybe to hand out as well.
You sent some last week that I forwarded on to her, and I put it on our little Teams chat communication thing, and everyone was going, "Oh yeah, I've had mine, it's okay," and I was like thinking, oh, that looks a bit billyish. And I thought, oh yeah, no, it's just that Norfolk and Suffolk Care Support want us to share this to everybody. So, FYI, and left it like that. But she didn't comment. So I think she's just made up her mind, and I don't think anyone can change that, to be honest.
No, that's really helpful though, Emily, that exactly what you're doing, and we have to respect that some people aren't going to take it. It's not mandatory, and you've done all the kind of support that you can, and we do recognize that some people are just not going to take it. So Gemma, here we are. I'll put all the flu resources on Knowledge Anglia, but can send something more specific if you think it would be helpful. And all the resources, I think, were they're on our website as well, and they go out in the e-bulletin and so on. So between us, we've got quite a bit. But yeah, thank you for sharing that, Emily. Thank you. How about everybody else? Has anybody had any issues around booster vaccinations, getting their staff to accept booster vaccinations? Because the capacity tracker, I mentioned this in a meeting previously, the capacity tracker is suggesting there is less than 50% take up in the social care staff. So I just wanted to sort of explore that a bit more. Is there any particular reason? Sorry, Tim, to bring you, Tim and Stephen. I didn't know whether you've got the latest figures at all around booster uptake in health and social. In social care staff?
Unless Stephen's got it.
No, I haven't got the latest.
I'm afraid I haven't either, but I can probably produce it before the end of this meeting. I'll have a quick look.
Okay, thanks ever so much. I mean, the last figure we had was something like near 48%, something like that with care homes, and it was something like 43-44% in home care. So clearly we would like to see more staff with boosters for protection, and the national average across the population for boosters is 64%. So there's a little bit of a way to go. Oh, here we are, 52% in care homes. Oh, thank you very much. So it's going up a little bit. We also did, in the previous meeting, discuss there seemed to be a problem with recording on the capacity tracker at the moment. It's down, so there may be a bit of a lag here. And Gemma and I had a conversation yesterday where we were trying to work out timescales of people accessing the booster, because if they had their second vaccination, by November, you probably wouldn't be having it until end of January maybe. If you've had COVID, that will be delayed, and so on. So it could push it forward into February, March time before we get a bigger uptake. Oh, thank you, Sarah. 49.64% in dom care. So there could be some other reasons why that figure isn't quite as high at the moment, but it's still suggesting that people aren't taking up the booster vaccine as much. And we're really trying to get a feel of why that might be. I don't know if anybody's got any other ideas. I know Tim's busy typing there. Did you want to come in, Tim?
I was literally only going to thank Sarah for producing the data to save me crunching it.
Right, okay. Well, if nobody's got any other ideas at all, and certainly the providers that we spoke to earlier were suggesting there were no problems, like Trina was saying, she had no problems, her staff were all really good, they'd all got boosters, they'd had all the 3 vaccinations, including the flu. If anybody's got any ideas about why people aren't taking up the booster as much, is there anybody on the call that recognise it as an issue? We'll move on. Oh, Ian, come in, Ian.
Yeah, I think it's. I mean, so my experience is what you've described. It's for people who've had their first and second doses later, who haven't been eligible for the booster, because all my staff who kind of got vaccinated right at the beginning and then got their second ones at the start, you know, they got their booster straight away. But it's just obviously those people who either want in that sequence, they joined us later, or, you know, kind of got vaccinated at different times. So I think once you've won the battle of actually getting them to have the vaccines, I think they do go for the boosters when they can. I don't think, certainly again from within my organisation, there's no one who's decided that they'll just have the 2 and that's them done with it. I think it is just people being out of sync and having to wait. And like I say, if you get a bout of COVID, that kicks everything down the line. So that could probably explain most of it.
That's yeah. I think that probably is the case, Ian. But thank you very much for sort of saying that as well. It's what we think, but we kind of need to know, really. And if there is anybody on the call that has got any staff that have got concerns about getting the vaccine or where to go, there's quite a bit of support around. Until the end of February, there's the, I don't know how to say it, Vaxi Taxi. So they can pick them up from either their home or where they work and take them to a vaccination centre. The person has to have booked the vaccination before they go, but it's free. And this is something, JabCab. Yeah, JabCab. Sorry, it was from a different county. It was called something different to begin with, but it's the JabCab. Yes. A JabCab until February, end of February. So that's also something just to let your staff know is available. I don't know if somebody can just pop that into the chat box just so that people are aware. We put it in the bulletin last week, so it's there, but that would be good.
I'm just getting the link for that now, Christine.
Brilliant, thank you so much. That's absolutely fantastic. And thank you, Gemma, in the chat box. She said here, if nothing will help change her mind, if that's the case, which is a shame, thank you for persevering and trying your best to support and encourage. Do come to us if we can be of any help at all. That's for you, Emily, from Gemma. So thank you for that, Gemma. Okay, so oh yeah, there we go. Yeah, winter vaccinations, there we go. It's all in there. Okay, so that's the JabCab. Right. Oh, here we go. Sarah, CSEOs. Sarah, did you want to come in and just say something about that? About the capacity tracker? Are you there, Sarah? Got radio silence.
Hello, here I am.
Hi. Oh, hi, Sarah. Hi.
Plug my headset in. Yeah. So Wendy and I have been targeting actually dom care providers this last week or so, and we have found that there are a surprising number who didn't realise that they should be entering data on the capacity tracker.
Ah, okay.
We'll get this information. So actually, we have a surprising amount of actual data, if that is the case. But there are allegedly some who believe that to be the case. So yeah, that may be making a difference.
Oh well, okay, Sarah, and has the sort of the outcome of those calls been that they are going to start recording on the capacity tracker?
Of course they are.
Oh, excellent, Sarah. This is good news.
Of course they are. But you know, there are things which are slowing that process down, including the fact that the capacity tracker at the moment is having a few problems. Also, as we have spoken about before, I believe, sometimes it's head office that does the entering of the data, and so information isn't getting from A to B, or it may be getting to B, but it's not going from B onto the CT, if you follow me. So yeah, there's a bit of a logjam there, as well. So but we are doing our best to encourage people and help where people are having difficulties, and you know, give them the telephone number and email address and so on and so forth for the capacity tracker to help team, and we're just doing what we can.
That's great, Sarah. Is it worthwhile maybe on this call just making it clear where people might be able to get in touch if, for example, this is a recorded session, if a domiciliary provider was to listen to this and they were concerned about what to do with the capacity tracker, is there a person that they could contact?
They could contact the capacity tracker help team. Sadly, Wendy and I we do not have sight of the capacity tracker, so we can't talk anybody through anything. We don't know what it looks like in reality. However, I can type in the chat the phone number, so that people can call that if they wish to.
Yes.
If you'd like me to do that.
Yeah. That would be great, and then I'll sort of say it out loud as well, Sarah, for the recording. But that would be really helpful. Thank you, Sarah. Thank you.
Okay. Right. Well, I suppose I could say it out for the recording, actually, couldn't I?
You could, Sarah.
Yeah, okay. Okay. So the phone number for the capacity tracker support line is 0191 691 3729. And they're open very long hours, actually. I think about something like 8:30 to 5:30, but don't quote me on that. But however, the phone number is correct.
That's excellent. And Tim has been your double act here,
because
he's actually yes, he has. He's put it into the chat box. So between you've covered all angles. So thank you very much, Sarah.
Right. Okay.
Thank you. Okay. Well, we'll move on to yes, it's the same number. Sorry, I was just reading in the chat box. It's the same number. Brilliant. Okay, thank you. So we'll move on to the next item on the agenda, and this is the vaccinations as a condition of deployment for care homes. Yes, for care homes, updated guidance. So I think.
So it's got both. So it's got the updated guidance for care homes, and it goes to wider social care in the next point.
Yes, yeah. I think we've got some updated guidance, haven't we, Megan? Did you want to pop it in the chat box?
Just pop in the links in the chat now. Yeah.
Oh, and by the way, welcome, Judy. Welcome. Oh, sorry. Keep ringing me. Sorry, I beg your pardon. Well, no problem, Judy. I'm glad you could make it. And we've got just while we're just putting some stuff in the chat box, Gemma says circulated in comms. Oh, right, okay. There's some drop-in sessions here that I think Gemma's put in the chat box. So what does this say? Sorry, this is new to me. They'll be running vaccine confidence Q&A sessions from Wednesday the 26th of January to February the 3rd. These sessions are for all staff to attend, will offer an opportunity to ask any specific questions you might have regarding COVID vaccines. Each of these drop-in sessions will be tailored towards a specific audience and hosted by a relevant clinical professional who will answer any questions and signpost you to additional information. So there's dates and themes. I don't know, yeah, and there's a link here. I just know, Gemma, that on the past you had the NHS registered. I think we've had problems with people accessing this before. I don't know whether you were able to find out if the social care sector could do that. I don't know if Cheryl or Gemma could say, because you have to have a registration number from NHS to access them. So I just wanted to know whether you've clarified that.
I have, sorry, it's Cheryl. I've got a feeling it isn't for social care staff, but I'll go back and find out before the end. Gemma, unless you know anything differently.
Thank you. I have been able to do it, but I've been able to do it as a company that's been registered with the NHS previously. So, but I don't think it's for everyone, and you certainly couldn't do it personally. So anyway, we'll find out a little bit more about that. Where are we got? We've got the vaccinations. Yes, condition of deployment in the wider care settings. That's the information. I'm so sorry, the care homes one was left on there. I should have taken that off. I beg your pardon. But this is for the wider social care settings. And so there is a webinar that is on Thursday the 27th, which is tomorrow, which is at 2:30, and the Eventbrite event there is in the chat box. So if anybody wants to attend that, that would be, could be extremely useful, because this is for outside care homes, this is domiciliary care, this is a housing with support, extra care, etc. So can I just ask everybody, actually, could you put the link, sorry, Megan, the actual link of the guidance for the wider social care settings?
Yep, bear with me, I'll just grab that.
Absolutely, in the chat box. And just ask our, our home care providers or supported living or people that have extra care services, if you've got any issues or concerns at the moment, or any questions you wanted to raise at all around this, because obviously dates are important here. Just as in care homes, it was about making sure staff were aware that they needed to be double vaccinated by the 1st of April. There were cut-off dates for informing people. I didn't know. I'm just letting Lindsay in. Whether anybody has got any particular concerns. So we've got some of our home care providers here, or supported living. I don't want to pick on you. Oh, Heart to Heart. Did you want to come in, Heart to Heart? How are you feeling about this?
Oh, we're okay, because fortunately everyone is vaccinated, and we had no issues whatsoever. But we are, like everybody, we are recruiting. So yes, it may be an issue in the future, but at the moment we're okay.
Okay. Okay, yeah, it's something to bear in mind when you are recruiting, because in order to be fully compliant, you would have had your first vaccination by a particular date. So it's very important to keep an eye on that when recruiting. Okay, is there anybody else? Ian, what about you, Ian Callan? How are things there?
Yeah, most of my staff are on board. I mean, most of them have been vaccinated a while ago. There's a few who have since got vaccinated as a result of the change in the legislation. I mean, they're not particularly happy about it, and I can understand why, but they've done it. And I've got a couple more who either haven't fully made up their mind or have indicated that they're going to do it, but they haven't confirmed with me they've done it yet. But like I said, it's just a case of I'll tie up those knots at the end, within the next couple of weeks, because we're kind of, the clock's ticking to the 3rd of February anyway, and then I'll kind of know where I stand either way. It is what it is.
Okay, yeah. Okay, yeah. Are you going to attend the Eventbrite, do you think? Because certainly when care homes were going through this process, those sessions were quite helpful in just giving a timeline and also some HR advice as well. So if you can attend, if not, we'll see if we can get a recording. Sometimes we can, so it just depends. We might be able to get a recording.
No, I don't know. I think I'm pretty much on top of it, because I know the process for getting the certificates from the staff, and I know the dates, and the HR department is me and one other person. So between us,
okay,
it's not a complex process.
Yeah. Okay, yeah, you've covered it off, Ian. Brilliant.
Yeah.
Okay, fine, lovely. Thank you, Ian. I'm just going to ask Jane Jiggins, are you there? Because you've got supported living, haven't you?
Well, it's classified as CQC classifies as residential care, so we're all covered by all that.
Oh, I beg your pardon. I'm so sorry. I just assumed
we did do a home care service at one time, but social care decided to take the contract away from us, and it was no longer financially viable.
Okay, yeah, all right then. That makes sense. Okay, I don't think there's anybody else. Is there any other home care provider that's got any concerns? If not, we should move on, and we'll just keep everybody up to date in our e-bulletins, and just let you know of any events like the Eventbrite around this, just to give people dates and awareness of those second vaccination dates, etc.
I've popped the deadline in there as well. So the last date by which existing staff can have the first dose to be fully vaccinated by the deadline is 3rd of February. Just saying it out loud for the recording.
Thank you, Megan. Thank you. That's brilliant. Okay, so what we got here, please could we have guidance on what to do if a client refuses? The only issue we have is clients who have refused. Where are we? I beg your pardon. I'm just trying to work out what the question was here. Emily, could you just come in?
Sorry, that wasn't me that actually asked that. That was Carolyn. She said that we have a client who's refused the vaccination. So have you got any advice on that? I'd completely forgotten that when you asked me earlier. Sorry.
Oh, okay. Yeah. So this is always a really tricky one, because obviously they're not compelled. It's not compulsory. So there is not much you can do apart from persuasion, and I don't mean it's a compassionate conversation. And just making people aware of the information, but because it's not compulsory for residents, there isn't anything else there. Oh, Tim.
Sorry, is that me? Could I just ask, this gentleman has Alzheimer's, so would that be, could we not go down the capacity route with him?
So I think I got that. Sorry, I was so worried about the sound. I turned my own off. I think this has come up before. So we're looking at sort of best interest. Can I just defer to Tim or somebody from public health around this? So if someone lacks mental capacity, can you go through this mental capacity's best interest and that person be vaccinated? So I don't know, Tim or public health. Tim?
Yeah, I'm not sure if there's public health colleague on the line. Also, I'm not sure if my mic is rubbish at the moment. Do let me know if it isn't. So in theory, you could take a best interest approach to this one, but I mean, the principle would be if that person is somebody who wouldn't normally have taken vaccinations anyway, then this would be no different. So if you happen to know that information, and you happen to know that somebody, for example, has never had a flu vaccination in their life, the likelihood is they wouldn't have wanted to take this either. And I'd argue that probably a best interest isn't the way to go with this, and just have to respect that that person's refusing, even if they don't have capacity to refuse formally, because the best interest decision is ultimately going to come to that decision as well. That unless the person's got a history of taking vaccinations, chances are they wouldn't have opted to do that, and that is one of the considerations in a best interest decision. But it's worth, the other thing is, I guess, is about what's motivating you to want to do that. So you've got to think about the interests of the individual, not about the staff that are working with the individual when it comes to that. So you could pursue it, and it would be worth then escalating it to a social worker to help make that decision with any relatives and clinicians that are involved in the person's case. I think if you know for a fact though that person's never had a vaccination in their life, then it wouldn't be worth subjecting them to that process.
Thank you, Tim. That's really helpful. We did have Emily come back to say, could we ask his GP to decide? And again, he'd still have to go through that whole process of best interest, wouldn't he, Tim?
Yes.
Yeah. I just want to make sure for the recording that we got a yes. Brilliant. Okay. I don't know, Emily, whether that person might have a social worker either. So it might be either worth, if they have, going back to the social worker, or if not, going back to the GP as well. But as Tim says, you have to think of broader considerations as well. Yeah, and it's for that person, for that individual. So thank you for that, and a great question as well. Is there anybody else that's got any other issues to raise around this? Around the vaccination compulsion? No? Okay, so we'll move on. So admissions and care of residents in a care home. So there's been some changes in the admission guidance, and there was some out, I believe it was the 20th of January, which has been updated from the 17th. So again, I'm so sorry, Megan, would you mind just popping that in the chat box as well?
I'm getting quicker.
There we go. Yeah. Here we go. So this is the latest admission information to care homes. So just so that you're aware that this is, the date is the 20th of January for this one. So again, it's bringing up to date the information about isolation, I believe, and I think that was it really. But everything is in there. I think that some of the concerns were around is it outbreaks?
At the top of the guidance as well, there's a summary of changes, which might be helpful for people to have a look over as well, because I know these can be quite long, these guidance documents, and a bit unwielding.
Yes, yeah. So it says updated to clarify the advice on admissions and self-isolation of residents. The testing, because there was changes to testing, so this consolidated all that testing information. It removed the section on how care homes can support the NHS as care homes are familiar with the process. Vaccinations, it updated the vaccinations section. And included information on flu vaccines for residents. It talked about clinical support. It updated accessing general clinical support, care of individual needs for people with learning disabilities, and information on the Mental Capacity Act has been consolidated. Caring for residents, it updated to clarify advice on outbreak management in the care home. That's what I was really trying to get to, because there was some anomalies early on around that, so that's updated that. Care for people at the end of life and after death, that's They've got added a link to the infection prevention and control guidance, and they've updated information on PPE. They've clarified advice on self-isolation for staff following close contact, and they've given additional information on self-isolation for staff returning from international travel. They've added information on staff testing. They've updated the mental health support for staff section, added information on staff vaccination. That's a repeat, but there we go. And signposted the management of staff and exposed patients of residents in health and social care setting guidance for advice on ending isolation before 10 days. I'll come back to that just in a second. And advice for care home managers was removed. The section on funding, as it's covered in the national support available to implement the guidance, and national support available to implement this guidance. It's updated the funding section to include information on the extension of the infection control testing until March 22. And it's clarified that providers can use the infection control testing fund to pay full wages to staff who are not required to self-isolate but are asked not to work in line with government guidance. An update to include information about the Workforce Recruitment and Retention Fund. So there's quite a lot of updates, and that was on the 20th of January. So I just wanted to make sure that people had seen that, and whether or not this raised any issues with you, or you've had any concerns with the new guidance. So really over to you. Have you had any issues at all with this new guidance? Are we all clear about the self-isolation periods?
No one's got their hand up at the moment.
No. And we're all clear about self-isolation periods. Has anybody got any queries or questions around that? No? Okay, well, if anybody thinks of something afterwards, please do let us know, or any queries that you've had, anything around the service that you've had, please do let us know. I think there has been some issues raised around admissions to care homes from hospitals. So I didn't know if there's anybody on the call that has got issues around admissions from care homes from hospitals to care homes from hospitals. Is there anybody on the call that's got any issues they wish to raise? Because we've got Judy Ames here as well that might be able to answer them. Has anybody got that? We have had a few queries, haven't we? I think Judy. Oh, hang on. What have we got here? Lorraine. Lorraine, come in, Lorraine.
Hello, Christine, everyone.
Hello.
We've had a query to take a gentleman into respite. We don't know the man. He's currently in the N&N. So he would be coming into our respite home. So I'm not really up to date with the guidance. Would he have to isolate for 14 days in his room?
It does depend on the test. I'm going to bring in Judy. Can I bring you in, Judy, on this? Is that okay?
Yes, of course. Hi. I mean, my understanding of the guidance is that any admission from a hospital would result in a 14-day isolation period. I didn't think there was an exception because you're respite. I'm just trying to find the section. I've got the guidance in front of me. All in the 14-day period. Oh, hang on, that's right.
There is a part in there, Judy, which it's if they specifically meet the set criteria. If you scroll down that little section, admission from hospitals, if they've had their vaccinations, if they've not been in contact with COVID, if they haven't tested positive themselves, then subject to a clinical risk assessment and by the provider themselves, then they didn't need to isolate, providing it was a planned admission. If it was an emergency admission and there was a likelihood that they had come in contact with COVID, etc., then yes, they would have to complete their 14-day isolation in their room I don't know if that's 14 days from a date of admission into hospital or 14 days date of admission into the care home.
That's helpful. Thanks, Gemma.
I believe this gentleman's been in hospital for quite a while, because they've not found anywhere for him to be transferred to.
Yeah.
So I know he's been in there since the middle of December at least.
Okay, I think if they're testing negative, then there is a sort of set process on there that if they've tested negative and they haven't come into contact with COVID, then they would follow that little, as long as they meet the criteria in the guidance, then they don't need to be isolated.
Okay, thank you.
Is that okay, Lorraine? And
yes, thank you.
Yeah, if you still got any concerns or just want to test something out or just ask, for clarification, just email us and we'll make sure that, we put that in writing to you. I know that the residential and nursing home information is going out today, and it picks up the points that Gemma has raised just now about it, and it's picked out the points in the guidance. So hopefully that will sort of reinforce what's been said as well. But the guidance link at least is in the chat box for you to have a look at. Is that okay, Lorraine?
Yes, thank you very much.
That's a pleasure. Okay. Is there anybody else that's got any questions, particularly sort of admissions from hospital or any other, maybe it's from the community? No? Okay. All right.
No other hands up.
No, that's fine. Okay. So we've got the self-isolation guidance for staff and residents. And again, you know what I'm going to do, Megan?
I'm on it.
Thank you. You're on it. Excellent. We've got these all lined up. So there's the new guidance for staff and residents on self-isolation. So as you'll be aware, there's been a change to this self-isolation, so that people can bring forward the return to work if they test negative for 2 consecutive LFD tests from day 5 following a positive test. So if, for example, someone tests negative on day 5 and they don't test negative on day 6, they have to continue to do LFD tests until we've got 2 consecutive negatives. If they do test negative on the 5th day and the morning of the 6th day, they can return to work. I don't know if there's anything anybody else wanted to mention about self-isolation guidance. There's quite a bit more in there as well, but has there been any other issues at all that's been raised around this by anybody? Has anybody got any particular concerns around self-isolation and dates and so on? No? Is that okay? It's clear? Is everybody clear about that? This was what's changed. So this came on the 17th of January, and it says the advice on ending isolations for patients who are contacts of COVID cases and who are remaining in hospital has changed. They can end self-isolation after 10 days subject to clinical risk assessment. So that sort of answers a bit of a previous question as well. The advice on ending isolation for staff who develop COVID symptoms or have tested positive on lateral flow device or PCR test has changed. They can now end their isolation on the 6th day, provided they have 2 consecutive negative LFD tests. The guidance for staff who are contacts of a case has not changed. So that sort of reinforces what I've just said. Emily, only query raised yesterday, not happened to us, but what happens if you repeatedly test positive? I know someone who's on her 21st day. Yeah, okay. So on the 10th day, it really suggests that you should see your GP, just in case there are any other underlying issues. I certainly know of cases where people have gone back to their GP on the 10th day and the GP has told them they should work. That's absolutely fine and carry on working because they have completed their 10 days. I don't know, Judy, if you've got any other information on that.
Well, interestingly, Christine, the reason I've got to go at 2 o'clock is I've got a meeting with one of the consultant virologists at the Norfolk and Norwich to talk about this very point, because we will have staff that will test positive between day 10 and day 14. And what worries me in particular are our community staff who obviously need evidence of a negative lateral flow to enter a care home setting. So I think that there has been discussion about perhaps some of these staff members having a pillar 1 PCR, so that we can look at something what we call the CT value. That's something we wouldn't get from a pillar 2, but that's why I've got the meeting with virology this afternoon. So when I've got a process in place, I'll share it with you, and Tim, I'll copy you in as well, because it will be the same, I think, for social care as our healthcare staff. So I'll keep you posted.
Oh, that's brilliant. Thank you very much. There is something in the guidance that says if you do continue to test a positive, to seek clinical advice. So it is in there, and I certainly know people that have done that.
And just pop in that section of the guidance that I sent Emily the other day in the chat as well. It's a bit long, but hopefully should be some information in there.
Thank you, Megan. Thank you, and thank you, Judy. And yes, that will be really helpful to have that, because we are aware that there are people that test positive beyond that 10 days. So really helpful. Thank you very much. Yes, that's the information there in the chat box. So hopefully people can see that. And just to explain, we will also send out some links after this as well, so that people are aware of all the links that we've discussed in the meeting today. Was there anything else that anybody else wanted to raise about self-isolation? Oh, we've got a new message. Let me just check. Oh, thank you. Okay, right, lovely, brilliant. Right, we'll just go on to outbreak guidance updates in care homes, and once again, Megan, if you don't mind just popping that into the chat box, that would be enormously helpful.
I'm on it.
Yes, thank you. And again, there's been some updates on this, and as soon as it's in here. Before that goes into the chat box, Cheryl's kindly put in here, the digital care home team have advised that if the NHS mail is used, then you should be able to access the training. Gemma put into the chat before. Okay, so if you've got NHS mail, you can use it. Yes, I think that's the issue. Not everyone has, so they can't all access it. So it's sort of it has to come with a proviso. You can access it if you've done that. Here we go. So there we go. This is the home testing. So this is the outbreak testing. This was updated on the 20th of January. So this is the regular and outbreak testing of staff and residents. So the changes to this publication were to reflect changes to the regular testing policy for staff in adult social care in England. It clarifies when the care home should contact the health protection team. The version replaces the care home COVID guidance available in the PDF format. Further guidance is made available elsewhere. So it gives you links to where you register your tests using the multiple upload spreadsheet, how to do a rapid lateral flow test at home or a test site, visiting arrangements in care homes, including the testing requirements, and the latest guidance for health and social care who've been identified as a contact of a positive case. So that's what's included in that guidance. I think one of the issues that has come up is about a sort of frequency of testing. So your usual testing would be 1 PCR a week and 3 LFTs in a care home. I'm talking specifically about care homes here. And that carries on the same with a resident, which would be monthly. However, in an outbreak, where there's an outbreak, you have 2 PCR tests for staff and 2 PCR tests for residents. And that happens, the PCR tests start on day 1, and then you would do a PCR test between day 4 and 7. And concurrently, you would do LFT tests daily up to 7 days, or I'm going to say if there's been 5 days of since the last test, positive test. So the guidance is in there. It is an increase in testing if there's an outbreak. So I don't know whether people are aware of that. I'm sure that people that are in outbreak will have been in contact with Judy's team and they will be advising them. Judy, have you had any issues at all in terms of people understanding the guidance?
We haven't had any queries. I don't know if Cheryl and Gemma have picked up any, or Stephen Long's team, but we haven't been made aware of any.
Excellent. Good to hear. Good to hear. Because it is complicated, isn't it, Judy? Because it
certainly is.
Yeah, it's that 2 PCR tests and the LFD test for 7 days, and that you have to do the second PCR test between day 4 and 7, and it's the ordering of the PCRs and the LFDs and the couriers and goodness knows what else. It's a lot of work, isn't it?
I will just say, sorry, Christine, sorry, I'm going to have to go to this other meeting, but I would just like to take the opportunity to say to everybody, really well done, because the messages we're getting from the QMOs and when we are contacting the few homes we're being asked to contact, everybody's infection prevention and control practice seems to be spot on. There's been no IPC concerns at all. So, and I know everyone's kind of well versed now, but it's a hard slog. Staff still wearing the PPE that the level we're expecting them to wear it, and it compliance, there's a risk that compliance wanes, but that's not the evidence we're seeing. So really well done to everybody, because the messages that we're getting is that the IPC precautions are still very good, and the numbers reflect that. The numbers in the outbreaks are quite small compared to where we've been previous peaks. So yeah, but we are here if anybody needs any support.
Thank you, Judy. Thank you so much. Thank you for a clap. You've got a clap there, Judy. So thank you. And I think that goes to everybody on the call as well for doing such a fantastic job as well in keeping those outbreak numbers down as well. So thank you for that. That's really helpful. But if anybody's got any concerns or queries around outbreak management and the outbreak guidance, should I say, please do email and we will signpost to the right people to answer that. Where we can, we'll quote from the guidance, but if there's something more specific, we'll signpost. It's not a problem at all. Okay, so we've actually come to the end of our agenda, but what I would like to do is to just offer out the time, really, with any queries that you had coming into this session. Was there anything specific that we haven't covered today that you wanted more information on? So I'm really throwing it out to you at the moment. Is there anything that you would like more information on or clarification? Let's just see. Lorraine's leaving, so that's fine. Thank you, Lorraine, for attending as always, and for doing a marvellous job as well. I don't think so. Is there anybody? No? Was there anything that anybody wanted to say from Tim's team? Tim, did you want to say anything? Did you want to raise anything at all? in terms of issues?
No, I don't think there's anything to, thanks Christine, but I don't think there's anything I'd like to raise. I would like to just echo the thanks to providers though for making such a fantastic effort, particularly after 2 years of wearing PPE. Unbelievable. So well done for that, and you know, and trying to keep COVID out as much as humanly possible. There's one I just want to put in a plug again for tomorrow for the Eventbrite meeting. Really, so we need to apologise that we only got notice of that yesterday. So we did email that out to providers yesterday. So I know it's really short notice, but I think it may answer some questions. It does say there's a Q&A as part of it as well. So hopefully that's real, and it'll give people an opportunity to have their questions answered there as well. But otherwise, no, thanks so much for what you're doing.
Thank you, Tim. Thank you very much. Thank you. I don't think I've picked up anything else. Oh, Emily here. Just double checking. Is this the latest guidance for home care? Emily, let me just double check that for you, because I don't think testing for home care. Yeah, the testing for home care still remains the same. It's 1 PCR a week. So the guidance, I'll get you the guidance, but it is still 1 PCR test per week. And obviously LFDs would be brought in if you were, if there was a positive case. But apart from that, it has not changed. We have been asked, and it's let me just get the date. And I'm glad Tim's nodding as well, because he this has come up quite a few times.
I think the document that you've put in, Emily, is the right one. I'll just pop this in the chat as well.
Thank you. I just wanted to double check, just in case.
Yeah, no. What I can say is that there was some. I know you were asked to complete a survey. Okay, you were asked to complete a survey to identify whether or not, if you did more testing regularly, you would pick up more positive cases between the PCR. And we did provide evidence back to the Department of Health and Social Care as a result of that survey. I had feedback that the DHSC were looking into it, but there has been no further update from that. So there's been no change to the guidance and no change to increased either PCR or LFD testing. So things remain the same. And I think that's all that we can say at the moment. We've taken it all the way up to the DHSC, and that's what they've said. Things remain the same. I hope that clarifies it for you, Emily.
Thank you. Yeah, it does.
Because it can be very confusing with so many changes going on elsewhere, can't it? You think, you know, especially with testing and things like that, you think, well, you know, does that mean it's changed in my provision? But the actual guidance around those changes were for care homes and supported living, and they're slightly different as well. So, but nothing for home care has changed. Okay. I think that's it, unless anybody else, I don't know, Cheryl, if you wanted to come in and say anything you wanted to raise or, you know, alert. I know we wanted to say something about flu, please encourage flu, but I mean, Emily's doing her best, as we can hear, getting all her staff and everybody with a flu vaccination.
I don't have any updates, thank you.
Oh, okay, Cheryl. Well, thanks ever so much. Thank you. Well, I think we'll leave it there unless anybody else finally wants to say anything. We'll leave it there. But thank you very much for attending. We will have this recorded and we'll put it on our website as usual, and we'll send out links. So thank you.